of sterilization. Now let us go forward and talk about the chemical methods. Under this, we are going to first start off with the alcohol. So what do we begin with? Chemical methods, lots of chemicals coming your way. I know it's a very dry topic, not that the other part of microbiology isn't, but this is the driest of them all, as all I can say. But yes, you know the importance of this in your practice because this is going to help you in all other subjects and also in your OPDs and OTs and elsewhere. So starting with alcohol, what is ethyl alcohol? We all know by this famous name of spirit. 70% ethyl alcohol. This is what you use as spirit over cotton swabs, nothing more needed. Isopropyl alcohol, another 70 to 80%. Remember, as a doctor, what you need to know, the thermometers and your stethoscope, which you never clean. We are all guilty of doing that, isn't it? So your stethoscopes and thermometers, they are going to be cleaned with isopropyl alcohol 72. So both the alcohols are 70 to 80%. These are alcohols. Now we are going to go on and talk about the aldehydes. You know formaldehyde, glutaraldehyde. So please note the mechanism of these aldehydes is going to be cross-linking and alkylating the molecules. Please note, cross-linking of the proteins, cross-linking of the molecules is what it does, and that is what is its method of sterilization. And what are the two aldehydes I told you? Formaldehyde and glutaraldehyde. Do you know formaldehyde? You must have heard of formalin because entire pathology and in lab smells of formalin. Entire anatomy dissection hall smells of formalin because all the human specimens are stored, are preserved in formalin. That is why your eyes burn a lot when you enter a pathology or lab or a anatomy and dissection hall. Also because you don't like those places, but your eyes burn primarily because of formalin. But you know that formalin is in which you put the organs and the dead bodies. That is basically liquid formalin. Formaldehyde doesn't come as a liquid. Formaldehyde is actually a gas. So the gaseous form of formaldehyde is there, and from gas we convert it into a liquid. So that gas is very important for OT fumigation. Please note, formaldehyde gas is also used for disinfecting the OT, for OT fumigation. Formalin in a liquid form is used for preserving specimens. And now next, when you go on to the chapter of Bacillus anthracis, Bacillus anthrax, you know it's a bioterrorism, very deadly agent. You know for a fact that this is something we can get from animals, right? From animal wool. So wool industry is very big. What you do? Before you dispatch wool, you disinfect it. How? By a process known as duckering. Duckering is a process in which the animal wool is treated with formaldehyde so that all the spores of the Bacillus anthracis are killed. This is a question that has come in the previous year. So these are the uses that you have for formaldehyde, but you're also going to have something called glutaraldehyde, which is going to be equally important. That also is an aldehyde, so that has the same cross-linking wala mechanism. Glutaraldehyde, you all know, of course, all of us have seen Sidex. Sidex written as a bottle in hospital, say your OTs, your OPDs, Sidex is written, it is nothing but glutaraldehyde. And all the scopes, bronchoscope, laryngoscopes, endoscopes. Now here comes a catch. Please remember, don't get confused. Ek to stethoscope doesn't come here, okay? These scopes are the ones which are going into the patient, broncho, laryngo, endo, hai na? So please note that I don't have to get confused with stethoscope. Stethoscope, I have already told you, is going to be isopropyl alcohol. Also remember two more things. Remember, if they have asked you about something known as an arthroscope being used in the by an orthopedician for joints, or if they have asked you something to do with urethroscope. Okay, arthroscope and urethroscope are going to be disinfected using plasma sterilization. They are going to be disinfected using plasma sterilization. Very important point for you to note. And I will tell you this once again when I go to plasma sterilization. So this is Sidex, glutaraldehyde. Okay, but please note that this Sidex has a problem. You have to first activate the complex, then only you can use that bottle. So you are going to activate it by alkalinization, and once you've activated it, you have to utilize that Sidex within 14 days. So you have to be using it within 14 days only. Its activity is only going to last for 14 days. So they said, isme to bahut problem hai, shelf life is so less, plus you have an extra step of alkalinization. So they said, please bring to us OPA-Sidex. What is OPA-Sidex? It is orthothalaldehyde. Orthothalaldehyde or OPA-Sidex. It comes as a 0.55% solution that can also be used for all these scopes that you have. But the advantage is that you are not going to have any that alkalinization wala step is not needed. So its shelf life is not 14 days. So it's going to stay on for a very long time. It's not just 14 days, it's stable for a longer time, and it has a better activity also. So OPA-Sidex is better than Sidex. However, most of our labs are using side X only. Now guys, before I move forward into the different other ones, phenols and everything, I want to ask you something from your pathology. Do you remember where in pathology did you study formaldehyde and glutaraldehyde? कहाँ पढ़ा था formaldehyde and glutaraldehyde? So if you remember, formaldehyde is used as 10% neutral buffered formalin. This is the fixative for light microscope, है ना? This is the fixative for light microscope, whereas glutaraldehyde is used as a concentration of 2 to 2.5%, and this is used when you want to do a fixative for electron microscope. Very important. 10% neutral buffered formalin is a fixative for light microscope, and 2 to 5% glutaraldehyde is a fixative of electron microscope. So yes, all your aldehydes are done. We can move on to the next family, and those are the phenols. So now पहले तो you will tell me कौन से scientist ने बताया था, which scientist told us that phenols can also be used. If you go back to your first chapter, don't you remember that we used something in antiseptic surgery? There was a scientist who told you that antiseptic surgery करना है. Joseph Lister, Sep for Sep, Joseph Lister told us that you have to basically go ahead and do antiseptic surgery, and for that he used carbolic acid. Carbolic acid is a phenol. So what is the mechanism of action? It is going to damage the cell membrane and precipitate the proteins. It damages the membrane, precipitates the protein, so the organism will be killed. So all the sharp instruments can be put in phenols. What all phenols you know? एक तो सिर्फ phenol 5%. Then you have other things like for floor cleaning you have Lysol. Lysol is also phenol. Cresol is also phenol. So phenol, Cresol, Lysol, ये same sound कर रहे हैं. But you know in the exam these modified phenols are asked a lot. That is Savlon and Dettol. So remember Dettol, what did I say? I have highlighted the adequate words. Dettol is going to be chloroxylenol. ठीक है? So Dettol में बहुत सारा OOO आएगा. Dettol is chloroxylenol. Whereas Savlon is going to be chlor. So सबसे पहले तो tell me how is Savlon sounding? Savlon is sounding like something to do with 6. तो 6 वाला molecule आएगा. Chlorhexidine will come, and another thing with S वाला sound, cetrimide will come. So please remember, Savlon contains 6 वाला and S वाला sound. 6 वाला मतलब chlorhexidine and cetrimide, whereas Dettol has all OO वाला things, chloroxylenol. These are very important modified phenols that you have. हो गया phenols. Now we move on to the next one, and those are going to be the halogens. We know halogens, you know the periodic tables in school time, iodine, bromide, chloride, है ना? तो halogens are the ones which are basically going to act as oxidizing agents, and I know the most famous iodine and chlorine which are used. Iodine mein what do we use for skin antiseptic? We use tincture iodine, which is 2% iodine for skin antiseptic, but we know there's one brown colored solution in the in the labs and the OTs that is known as betadine. What is betadine? Betadine is a povidone iodine which is said to be iodophore. Matlab, what is povidone iodine? In this you take iodine, and that iodine is going to be adsorbed onto some kind of a neutral carrier. I can give you an example of a neutral carrier. It is a polyvinyl pyrrolidone. So if you break this word now, it is sounding like povidone. Povidone. Now you understand why I called it povidone. So PO for poly, VI for vinyl, and don, pyrrolidone. So povidone is actually because iodine has been adsorbed on this particular carrier, and this is going to be better because this shall have residual action. This is going to have residual action. That is why it's considered to be better. That is why we use betadine over regular iodine. This was about iodine. About chlorine, I think I don't need to tell you. You guys already know that we have hypochlorite which is used for blood spills. I'm going to tell you the blood spill management also in a while. So yes, hypochlorite is what we use. There are different compositions available. They say that how much of hypochlorite should you be using? That depends on how much of the blood has spilled. So if they say that there is a less than 10 ml spill that has occurred, you can actually, so you will obviously say कि ma'am मेरे department में तो I have a full bottle of hypochlorite. How should I prepare? So if you have a spill of less than 10 ml, you should use 1:100 ka dilution. If you have more than 10 ml ka spill, if there is a more than 10 ml spill, you should use a higher concentration, of course, because there's too much of spill. So you should use 1:10, means you're going to dilute it in 10 times water. So you basically dilute this hypochlorite in water. So basically for blood spills, agar chota wala blood spill hai, you can dilute it more. If it is a huge blood spill, you're going to dilute it less, means you're going to use a higher concentration. More amount of blood, you will require higher concentration, 1:10. So guys, what is the blood spill management? Now, you will feel that, ma'am, ye kya padne wala to kuch hai hi nahi. Just think logically what you should be doing. These are no steps that I can sit and actually give you mnemonics and make you ratify, because this is so organically it should come. Just imagine you are an intern, you were carrying a rack full of slides, or you are carrying a rack full of vacutainers or some glass tubes, and unfortunately you trip and you fall and all the blood is on the floor. Now what are you supposed to do? So first you are going to block off that area so that no one is gonna come and walk over it. So first is put a cautionary board and block off that area with whatever is available in your department or ward. After that, the first thing is take care of yourself. Wear a pair of non-sterile gloves, and after that, first make sure that before you start handling that area, apna pura PPE you have to have ready. And after that, before you start touching on those things, at least make sure is there any sharp, because you had broken a glass tube. So make sure that whatever broken glass you have, that is first cleared. Then I'll take care of the blood spill. So you're not going to pick it up with your hand. You have a full PPE kit and you have a management. There's a spill management kit which every department has. So you get that out. You will see that will have tongs and a pan and a brush so that you can sweep off. You will use those tongs, are like those two tongs. You're going to just hold it. Everything that has glass pieces, you put it in the pan, and all of that, you, like I said, do not pick up pieces with your hand. You're not harming yourself, because they could be the blood of an HIV positive person also. So taking your own precautionary measures is the primary thing that you're going to do. And whatever broken pieces you have got, at least clear them out, put them in a sharps container. That is the first thing that you do. After that, you see that it's 2 or 3 drops of blood, so never mind. But if you have like puddles of blood over there, you can't just put sodium hypochlorite uske upar and go away. No, first absorb all that extra. You can't create a puddle over there. So first take paper towels and absorb as much of the fluid as possible, so that all the additional fluid is done. Throw it in the whichever hazardous container you have. Now guys, you are going to put sodium hypochlorite. I am assuming 1:10 dilution. I am assuming there was a very large spill, तो पहले सारा absorb करा paper towel से, then you put sodium hypochlorite over it. After that, whatever you have, those tongs, those pan, that brush, जो भी है, meanwhile you clean it properly, you wash it under tap water and you leave it for dry. After that, you are gonna remove your gloves and you're gonna discard it. Then you're gonna wash your hands. This is something which we tend to forget, because we don't take care of ourselves in that process. We wash the hand carefully with soap and water. That is very important. Whatever towel you will use, remember hand hygiene, whatever towel you use, it is to be a single-use towel. And this is again a step we forget to do. Record the incident. Every lab has an incident book in which you have to mention that this was a hazard, this is the date, this is the time on which it happened, these are the measures that I took, and everything is settled. So everything has to be recorded in that. If anything was broken, if anything was lost, if any person got infected, who were the people on duty, वो पूरा एक incident book होता है, and everything has to be recorded under it. So now moving back, the most important step over here was you had to saturate the area with sodium hypochlorite.